Ever wondered how our kidneys maintain the acid-base balance in our body? These unsung heroes of our body work tirelessly, ensuring we remain healthy and active. They filter our blood, expel waste, and most importantly, they maintain a fine balance of acids and bases crucial for our body's optimal functioning. But what happens when this balance is disrupted? What happens when our kidneys struggle to keep up with their intricate juggling act? Well, that's when we enter the realm of renal tubular acidosis, or RTA for short. It's a condition where our kidneys, for various reasons, can't maintain the normal acid-base balance. This can happen due to defects in acid excretion or bicarbonate reabsorption. The result? A body struggling to function optimally, leading to a myriad of health issues. But what exactly is renal tubular acidosis? Renal tubular acidosis, or RTA, is a condition where the kidneys struggle to keep the acid-base balance in our body. Imagine a scale where one end is acid and the other is base. Normally our kidneys do a fantastic job of keeping this scale balanced. But in RTA, the scale tips, either due to problems with acid excretion or bicarbonate reabsorption. Now there are a few types of RTA, each with its own quirks. First, we have distal RTA, also known as type 1. This occurs when our kidneys can't properly excrete acid into urine, leading to an acidic blood condition. Next up is proximal RTA, or type 2. This happens when the kidneys have trouble reabsorbing bicarbonate, a substance that helps neutralize acid. Then there's hyperkalemic RTA type 4. This one's a bit different because it's characterized by high levels of potassium in the blood. And lastly, we have the rare type 3, which is typically seen in children and involves features of both distal and proximal RTA. So how do doctors diagnose this condition? Diagnosing RTA involves assessing urinary acid and bicarbonate secretion. Now, you might be wondering, how does that work? Well, it's a bit like a detective story. Medical professionals look for clues in the form of symptoms, and then use specific tests to confirm their suspicions. When it comes to renal tubular acidosis, or RTA for short, the symptoms vary, but they often include fatigue, muscle weakness, and frequent urination. Imagine feeling tired all the time, even after a good night's sleep, or noticing your muscles don't seem to have the strength they used to. Or perhaps you find yourself needing to relieve your bladder more often than seems normal. These could be signs of RTA. To confirm a diagnosis, doctors will then assess the acid and bicarbonate levels in your urine. This helps them to understand how well your kidneys are doing their job of maintaining a healthy acid-base balance in your body. If the balance is off, it could be a sign of RTA. Remember, knowledge is power. If you or someone you know is experiencing these symptoms, it's essential to seek medical advice. But just how common is RTA? Well, stay tuned to find out. RTA is not very common, but it can affect anyone. The incidence rate, while not precisely known, is estimated to be relatively low. Yet it's important to understand that RTA can occur in any age group, from infants to the elderly. When it comes to gender distribution, RTA doesn't discriminate either. It's been observed in both males and females, with no significant bias towards any one gender. Despite these challenges, people with RTA can still lead fulfilling lives. Living with RTA is possible with the right treatment and lifestyle changes. For some, this could mean alkali therapy, which helps to manage distal or proximal RTA. Others might require dietary modifications or new pharmacotherapies to control hyperkalemic RTA. Lifestyle changes can also play a significant role in managing this condition. It's about adapting, adjusting, and working with your medical team to find the best solution for you. So, while our kidneys are vital for maintaining our body's balance, it's important to know that even when they struggle, there are ways to manage and thrive. Like, share, comment, and subscribe.